next, we are joined by Jason Waller, who's the Managing Director and CEO of health technology company InteliCare Holdings, with the ticker code ICR. So to tell us more, I'll introduce Jason.
Thank you.
I'll bring up your presentation. I'll let you jump into it.
So InteliCare is a technology company operating in the age and disability care space. So what we do is we turn any home into a smart home by installing a range of sensors, and then using an app, we connect our sensors to our IoT platform and use AI to look at what's normal behaviour in that home. And then we send alerts out to family and caregivers when something's out of the ordinary. And by doing so, we allow people with a disability to live in their home safely, or people who are elderly to live in their home for longer and avoid residential aged care. Key highlights, it's obviously a very strong market trend at the moment, and I'll talk more about the aged care space, but I think it's never been more dominant in the conversation within Australia and particularly within investment. We have our own IoT platform, that's our secret sauce. And also the government funding behind this is increasing. Our product can be purchased both by a home care package, and the government recently announced another $8 billion into that funding, and through NDIS. As we've already discussed, it's a Saas business, so there's high margins on our recurring revenue. And we're using AI and machine learning to do something that hasn't really been done before in this area. We listed on the ASX in May 2020 and have continued to start to scale our business and grow commercially since then. It's a very topical space, as I mentioned, and not just within Australia. We're following the Royal Commission. The government implemented another $10 billion to boost aged care, but internationally as well. Biden has pledged similarly at $400 billion into healthcare, and particularly with a focus on allowing seniors living in their home for longer. So we're exploring our international expansion plans at the moment. Since we listed and sort of a comparative time last year, we've grown quite considerably from 25 units in the field to about 450 under contract. Our revenues have been increasing quarter on quarter. From our last reports, we had a 911% increase in cash receipts, coming off a relatively low base, but nevertheless, it demonstrates we have strong market traction and product to market fit. And on the back of that, we recently raised another $2.5 million to expand our presence on the east coast of Australia. When people think about the aged care industry, they often think about nursing homes, but it's much larger and broader than that. Care in total is about a $40 billion industry in Australia when we combine aged care and disability care. And a lot of that growth is being driven by the baby boomers. So there is a macro trend here that we're capturing. The baby boomers are moving from their retirement phase into their aging phase. And simply put, government spending is trying to keep up with that, but can't do it. So what we're seeing is market stress as demand starts to outstrip the ability of care providers to supply. Aged care homes, like nursing homes, are mostly unprofitable. And even in home care, those that send people out to look after people in their own home, the EBITDA per client has been decreasing year upon year. As the Morrison government has thrown more money at the problem, they're starting to catch some of this downfall. But nevertheless, there's going to be a significant market for people who want to stay in their own home. And when they do so, they turn to technology because they don't want to end up in a nursing home. However, the primary source of technology that keeps them safe are pendants. So they're like duress systems, alarm devices that might be worn around the neck or have a button sitting on a bench somewhere in the home. The main problem with those is people don't use them. In 80% of falls, people didn't use their pendant. And even in nearly 30% of the falls, even when they had a working pendant, they were lying on the floor and not willing to press it. But most importantly, those competing technologies are fatally flawed in that they're just duress systems that respond after the event. They do nothing to predict or prevent events occurring in the first place. Whereas InteliCare's system does both. We do both detect the events and we're starting to increase our ability to predict the likelihood of events, but we provide this prevention element to stop them occurring in the first place. So rather than waiting for someone to have, metaphorically fallen off the cliff, we catch them as they're walking to the edge. How do we do it? Well, in the first step, we install sensors in the home. They're not cameras, they're not invasive, and importantly, they're not necessarily wearables. A big problem with wearables is the elderly in particular don't like to wear them. They require charging, and there's gaps in their coverage as a result. We have an open IoT architecture, and what that means is we get the best and brightest sensors and integrate them onto our IoT platform. We aren't a sensor manufacturer. All the sensors you see, such as movement detectors, door detectors, power sensors, including pendants and smartwatches and voice devices, are manufactured by others, and we're an integration platform that brings it together. We can then use that combination of sensors to learn what's normal behaviour in a home in step 2, such as how often people are moving around, when they're up each day, what their meal activity is like, and when they're becoming social isolated. All of those elements are key predictors of deterioration in health and well-being. And then we send out an alert to family and caregivers in step 3 when something's out of the ordinary. Importantly, on the app, the family will also get a push notification to their phone when everything's okay. So they don't have to live inside the app. They can just look at their push notifications. For professional care organisations, which represents about 80% of our revenue to date, they use a dashboard to monitor multiple clients at once. And then step 4, we look for increased early incident detection to try to get ahead of the event. So for example, if they're looking at increased bathroom usage, then that might point to an undiagnosed urinary tract infection, and UTIs are a major cause of a fall. So we'll see that before anyone else does, and hopefully before the trigger event that will cause loss of independence occurs. So we take a layered approach. At the bottom of the layer, we have our core client intelligence. These are the passive sensors, the movement sensors, door sensors, power sensors. On top of that, we've also integrated emergency alerting system through smart devices like watches, pendants, and also voice activation, including we're integrating Amazon Alexa at the moment, and other devices that can provide that real-time emergency alerting. And then more recently, we've also put on top a vitals and health metrics layer, so we can start to track pulse, blood oximetry, rests, and heart rate. And particularly for GPs and super clinics, they become critically important to provide that additional layer of intelligence. Finally, servicing that through our Pro dashboard in the app using our artificial intelligence to provide a whole coverage with very few gaps in the whole system in terms of remote monitoring. We surface the data through 2 forms. There's our B2B interface, which is InteliCare Pro. The clients there are bulk purchasers, they're care providers that either have a care in the home business or residential aged care, or even, and we're looking at now hospital in the home as well. They're larger purchases, larger accounts, but they have a longer lead time, but it allows them to increase their productivity and deliver care to where it's needed most. For the family, they consume via just the app themselves, so they and all their carer will use the app. It's a low-cost way of ensuring that they don't have to keep responding and checking in each day. So across the board, we're targeting these verticals, certainly independent living, as I just described, for the consumers themselves, particularly the sandwich generation, those people who are caught between looking after their children and their elderly parents as well. For governments, it's all about reducing the aged care tax burden and transmission pathways during COVID-19. But our central value proposition is with elderly and disability care, targeting those home care providers in particular. We're also starting to talk to hospitals, particularly those using hospitals in the home, and with a target of reducing the transmission and the readmission pathways from people exiting hospital and then being readmitted. And lastly, insurers, particularly in the United States, where they can use it to reduce their underwriting risks, where they have private health insurance and people want to avoid going to residential aged care, which is more expensive compared to home care. As I said, we have a SaaS business, but we're slightly different to some of the others. We do charge for the hardware up front. So you can think of it like a telecom business where you have the initial purchase of the sensors and then an ongoing recurring fee for use of the app. We also provide a rental model where they can bundle in the hardware and the software costs under just one recurring payment, and we've done sales for both at the moment. Our aim here is to not provide the hardware at a high margin, but a reasonable margin. And that really can become part of our customer acquisition cost by reducing that margin to increase the SaaS part of the recurring revenue. So we're going out through B2B. Through that part, we're targeting the aged and disability carers. There's about 1.1 million people in Australia under that care model. As I said at the outset, most people think of nursing homes as the core market, but there's only about 200,000 people who are in nursing homes in Australia. So on a unit basis, the home care industry is much larger. It's about 5 times larger. And then another 3 to 4 times again is just the B2C consumer business, targeting those end users, families who either have someone under a care package or are financing it themselves out of their own pocket. And then lastly, through distributors and agents, either retailers who provide other mobility devices and aged care and disability care systems and assistive technology, or those businesses such as the care providers themselves, who can then operate as an agent towards the end of to the end users. Initially in Western Australia, if we achieved about 3.2% of that market, we'd come close to break even. More recently, we have grown that channel for B2C through to consumers, particularly targeting the eldest 45 to 65-year-old daughter in the family who often wears that burden. We made a recent announcement looking at the results from their campaign. It's been significant, particularly the TV portion. We've gone across all channels, including TV and radio. We recently rebudgeted so that we moved some of the radio money to TV where it was more productive generating leads. And we're now starting to show good conversion rates of those leads at the consumer level into ongoing sales. Next slide. So in the future, where are we going? Incorporating next generation sensors and devices to improve that intelligent incident protection. Increasing our machine learning capability. We recently received a government grant to partner with the University of Sydney and Macquarie University to improve our machine learning so we become much more predictive and start to really get ahead of the events in the first place. And lastly, integrating our system with client systems. So their case management and client management systems become part of InteliCare and are fed automatically and under one workflow. Our execution team, we have Greg Leach and Mike Tappan, who are the co-founders, and myself. We all have significant ASX experience building and exiting from technology companies. So it really becomes a commercialization and execution problem at this point. As I said, we recently raised another 2.5 million on the ASX, and we listed at 2.5 times our listing, probably a little bit overcooked at that stage, but we've stabilised at a good price at this stage. And I think with the kind of recurring revenue we'll see from future contracts, we'd see the typical SaaS uplift in the share price. So in summary, it really becomes a execution problem. I think someone will occupy this space. The aged care industry really is in crisis worldwide and is begging for this kind of solution to increase the productivity of care providers, underpin their risk associated with this rise in demand, and provide consumers with an alternative to placing their parents in residential aged care. Thank you.
Well, thank you for that. That was great. We've had a few questions come through, so I'll jump into them. So what is the competitive landscape like in the US?
Similar to Australia, it's very much an emerging market. So we're a new category. We're not trying to displace an existing provider. I think the US is more prospective because of their lack of universal healthcare and the fact they rely largely on an insurance model. The competitors at the end of the day really are pendant and duress systems, which are rather ubiquitous in the market and a bit of a set and forget. We have seen from our initial foray into there that there is no dominant player that's would be trying to displace. It really is those pendant systems.
And I know you touched on this last part, but I'll ask it anyway. So the recent federal budget means a lot for the sector. So how are InteliCare approaching it?
We're heavily engaged with the government, and we've had a lot of interest from them. We're trying to become part of the rollout of the solutions from the Royal Royal Commission into Aged Care. InteliCare was mentioned in the report. The biggest problem that the government will face with the increased funding is finding enough staff to deliver on that funding just from the services model. So they're wrapping in assistive technology as a new funding stream. That'll occur over the next 2 years if nothing with government moves quickly. But that, I think, will underpin this model in the future, where I literally speak weekly with members of government around this and promoting our product and, more important, assistive technology in general.
Great. Well, thank you for joining us today, Jason. We look forward to having you on next time.
My pleasure.